Assalamu alaikum, ladies and gentlemen. Welcome to yet again another edition of the S Stories right here on Sophiya Anjam's official YouTube channel. Every Friday 7 p.m. we host a special show for you. And you know, sometimes it's about a humanitarian effort, a cause that I firmly believe in. Sometimes we have guests over. So today we should be talking about mental health. The different kind of mental disorders. अमूमन ऐसा होता है कि जब हमारे जो भी हमारा एक सोशल सर्कल है उसके अंदर हमारे फैमिली मेम्बर्स हों या फ्रेंड्स हों या कोलीग्स हों, हमें जो है ये पता ज़रूर होता है कि देयर इज़ समथिंग रॉन्ग, बट शायद हम घबराते हैं टू मे बी अप्रोच दैम. समटाइम्स यू डोंट नो हाउ टू डील विद दैम. समटाइम्स इफ़ वी आर सफरिंग फ्रॉम एनी काइंड ऑफ अ मेंटल डिसऑर्डर, हमें ऐसा लगता है दैट लोग क्या कहेंगे. Oh hi, what are people going to say? What am I going to do? What is my family going to say? So there is a certain kind of a taboo in our society as well. So today, ladies and gentlemen, we shall be shunning all of that. And you know what they say? They say that your illness does not define you. Your courage and your strength is what truly defines you. So on the show today, we should be having a very special guest over, Dr. Usman Qayyum. हम आपको अभी statistics भी बताएंगे that where do we stand in our society today, and go ahead and take a look. Alright, ladies and gentlemen, you just saw the video. We had a lot of statistics, a lot of facts and figures also pertaining to mental disorders in our society. And now I'm really excited and very honored to be interviewing somebody who I love and adore. And trust me, every single time I have had a conversation with him, I've always learned a few things. Ladies and gentlemen, let's warmly welcome Dr. Usman Qayyum. Assalamu alaikum, how are you?
Assalamu alaikum.
It's a pleasure to have you here.
It's a pleasure to be here.
Alright, wonderful. Now let me introduce him properly as well. Dr. Usman Qayyum is a board certified psychiatrist practicing in Boston, USA. He specializes in the treatment of adult mood disorders and attention deficit disorders. And most recently, he's one of the leading psychiatrists working with the innovative new treatment technology TMS. Quite fancy, I must say. What exactly is TMS?
TMS stands for transcranial magnetic stimulation.
Okay.
To put it very simply, we're using the technology of an MRI.
Alright.
Using higher amplitude, higher frequency waves.
Okay.
To stimulate parts of the brain that have been associated with depression.
Okay, okay. I haven't heard about this before though, I must mention this.
It is, it's a newer technology. Yeah. The FDA, Food and Drug Administration in the US, approved it in 2009.
Okay.
We've been using it for the last few years.
Okay.
It's very innovative, basically for treatment-resistant depression.
Right.
But the other indications, the expanding indications for TMS are going to be in anxiety disorders, obsessive-compulsive disorders, post-traumatic stress disorders, and substance abuse disorders.
Right, right, of course.
So this is the cutting edge in psychiatry.
This is amazing. So do you think it's going to come to Pakistan anytime soon?
Well, I certainly hope so.
Shall we keep our fingers crossed?
I certainly hope so because, again, just not from my own experience, but when we look at the data that's come out, it's not for everyone, but it's for people who have tried and failed other treatment possibilities. And there is a sizable population out there. So for them, this is a life-saving technology.
Absolutely, absolutely.
Unfortunately, because it's a newer technology, the cost is quite high.
Okay, okay.
So to bring it to the Pakistan market, I think it's going to need some work. I think it's going to need some innovation. Yes.
Absolutely, but we're really looking forward to it as well. Now that you've set the ball game and it's rolling. So now, Dr. Sam, I have a question for you. When it comes to our society in particular, depression is quite prevalent. What exactly is depression to begin with?
To put it simplistically, depression is a sense of sadness, a sense of profound sadness, which is above and beyond the normal experience of sadness. Most of us in our life experience sadness.
And do we feel that we are depressed, or sometimes we don't feel as if we are depressed, but we actually are?
I think depression is a very subjective feeling. It's difficult to kind of think about that you can be depressed without knowing. Once you're depressed, you're depressed. People feel it. It's as real for people as being hurt, as breaking an arm. For some people, the experience is even more profound and difficult because there's an emotional sense of hurt that is very difficult to describe. And especially when other people don't see it. So I hope that answers your question.
Absolutely it does. So now let's come to the different sort of causes of depression also. It is hereditary as well, right?
It can
and
be.
Also a lot of factors might lead up to depression. So let's talk about those factors.
Well, again, I think there's different factors. Depression itself is very multifactorial. You mentioned hereditary, the genetics. There's a lot of work being done. Bipolar disorders are now being linked to a particular gene, but that's not the only cause. You know, there can be depression, which we call situational depressions. People go through stressors in life. They lose
trigger points.
Yes, trigger points. They go through, you know, they lose a spouse, they lose a business. Something happens in the family.
Accident.
There can be profound sense of loss. And that can turn into depression. So I think the important thing for people to realize is that there's a difference between normal existential sadness and depression. We all experience sadness. It doesn't necessarily has to be clinically treated. Although not a bad idea to talk to your loved ones, to your friends, to your family.
That's always a good idea.
Yes. But depression itself is, we're recognizing it as an illness, which needs to be recognized. It's not just an inadequacy in somebody that they're depressed. People say, well, I have everything in life. I have a good family, I have a spouse, I have kids, you know, and I hear this all the time. Doctor, I don't know why I feel this way. So if they had a choice, they wouldn't. And that's what depression is.
Absolutely. So now let's also talk about the different types of depression.
Well, again, the different types of depression can range from the mild existential situational depressions where people have situational life stressors, to the more extreme would be the significant bipolar or severe depressions where the patients are basically paralyzed because of the severity of the symptoms. So within that context, you have people, clinically we classify depressions as the mild dysthymic disorders. We can have major depressions, which can be single episodes, recurrent episodes. Then we have bipolar disorders, where people have recurrent episodes of depression. And then the other extreme, we also have bipolar illnesses, which have the classical severe mood swings, where they go from being very manic to being very depressed, profoundly depressed.
So also, you know, I was just thinking about it that a lot of artists and a lot of famous personalities have also suffered from depression. And bizarre, वो बहुत ही खुश लगते थे. अगर आप उनको देखते थे तो लगता था कि वो बिल्कुल सही है, जिस तरह आपने भी बोला था that they had a good career or a good family or whatever it is, you know, it fits the whole entire frame altogether. But so if we have to learn how to tackle depression, how do we deal with the patients of depression?
Well, I don't think there's one answer to that. Every patient is different. Every patient's needs are different. I think to deal with the patient it depends, you know, if you're as a physician or a psychiatrist, I would deal with the patient differently. If you're talking about the family, let's start with what should the family do? I think the family needs to recognize, to empathize, give the patient the support that they need.
Empathize, very important word.
Yes.
Yeah.
And it's basically be there for the patient who are struggling. I think the paradigm for the family should be, if the patient unfortunately broke a leg or an accident, how would they deal with the patient? True. So depression should not be very different.
Right. Because it's not tangible. See, now people feel it's in the head, right? And they feel they can't really touch it. Like if you have flu, you have cough, or you have a fever, then instantly you take medications and get rid of it. Right. So sometimes people feel that it's not tangible, it doesn't exist.
Sure.
So maybe that's also like a taboo in the society in a way.
I think you're absolutely right, Sophiya. That I think especially culturally we are dealing with different issues here.
Right.
The stigma.
Yeah.
The fact that people are very uncomfortable about
even talking about
it. Some people see it as an inadequacy in their self. Some family members may see it as an inadequacy. That's not true. We know it. The data is there, but the awareness. I think people like yourself, people in the media, people need to make more of an effort to bring depression out of darkness.
Right.
That's very important because help is there. Once people realize that this is not a personal feeling on their part, and there is help available. The results for treatment, for depression treatment are there.
Right. So there are different types of treatment.
Yes.
Sometimes you prescribe a lot of medications, and sometimes you also have a lot of these different therapies. What do you think works the best for Pakistan? Well, holistically speaking.
I think I can kind of, I don't want to specifically talk about Pakistan because now depression, if you look at it as a disease model, then it should be the same. The evidence should be the same as it is if we were treating cardiac disease.
Right.
Or if you're treating pneumonia. The statistics for heart disease in Pakistan are there. The statistics for depression worldwide are there. Right. So if we assume that the incidence of a particular kind of depression, biological depression, is the same all over the world, then the same is true for Pakistan. Whether or not the same amount of people are getting treatment or not is different.
Right.
So coming back to what are the treatment options, medication is a very important treatment option. It is one of the treatment options. The best outcomes are when we combine medication with therapy.
Right, of course.
And if you want, we can kind of expand a little bit
more on that. I think we would love that. Yes.
In therapy, we are having some breakthroughs in cognitive behavioral therapy for the treatment of depression, for anxiety. Mindfulness is a new treatment modality.
All right.
We still have some therapists who do what's called supportive therapy. There's some good results with that. The antidepressants, we generally don't have to use a lot of medications, but there are some very potent, very effective medications that are available for depression. SSRIs, NSRIs, we have the new generation antidepressants. So there's a host of treatment options that are available.
Absolutely. So basically the thing is that people need to realize that they always have a platform, they have doctors available, they have experts available. You just need to reach out. And a good supportive system is also very important, like we mentioned earlier. So if any one of your family members is suffering, or your friends or your colleagues for that matter, you have to be empathetic and have to understand what really goes in that person's mind. Up next, Dr. Saab, let's talk about anxiety now. Again, what is anxiety?
Well, to define it simply, it's the fear of impending doom.
Okay.
If you want to translate that into something that
कि कुछ बुरा होने वाला है, आपको डर लगता है किसी चीज से, like what could possibly happen, which is going to be the worst possible scenario.
I think that is exactly, it's the fear of the unknown. For people who have anxiety, they internalize it as a very realistic fear, and then live with that fear day in, day out.
Right, right.
And it's very debilitating for them.
Okay, and again, so what are the causes of anxiety?
Again, the causes can be multifactorial.
Okay.
We have found that anxiety disorders do tend to run in families.
Right.
An extreme case of anxiety is what's called OCD, or obsessive compulsive disorders, where people compulsively do cleaning, checking, their thought process is very ritualistic.
Right.
And again, these are very debilitating disorders, as is anxiety.
Absolutely. So I also have heard a lot about panic attacks that people usually have. How would you define a panic attack, and how would you know that you are having a panic attack?
Well, for somebody who's had a panic attack, they will know, because it's a very frightening experience.
Right.
It's a very debilitating, frightening experience.
You get an uncontrollable for a while?
You have two sets of symptoms in panic attacks.
Right.
One is a very physical sense of discomfort.
Okay.
Some people describe they're having a heart attack. Some people describe that they're going to faint or pass out. So there's a set of cardiac, neurological, and physiological changes that occur in the body. Heart rate goes up, your pupils dilate. Basically, when somebody is having a panic attack, they're having what's called a fight or flight response, which is kind of genetically modulated for us. Main defense mechanism is the fight or flight response. If you were confronted with say a dog attacking you, or in the old days if there was an animal or a lion attacking you, your body would react by responding. Your heart rate would go up, your breathing would become faster, your pulse rate would go up, so you would either fight or you would take flight. That is exactly what's happening in a panic attack, but it is unprovoked. So somehow the brain is perceiving a threat and firing neuronal blasts that is stimulating the body to release catecholamines, all kinds of hormones, neurotransmitters that are eliciting the fight or flight response.
Right. Wow. You know, that is actually quite shocking also, just to get to know all these different sort of definitions and all these different factors also. Okay, so again, coming to the treatments, more or less the same for depression?
For depression, again, the range is a little bit different. The medications that we do use some antidepressants, but we are also using very specific anti-anxiety agents, which are quite effective. What we try to do is use medications initially to break the cycle of anxiety and the panic attacks, get people more functional, because the risk of not treating is people start avoiding things. They start avoiding family, friends, going to social situations, and they become essentially housebound. So it becomes a very vicious cycle. To get them out, we start them off with some medication which lowers the physical response to anxiety. We encourage them to go out, to confront some of the phobias or fears of going out. And then there's obviously therapy.
Absolutely.
Again, cognitive behavioral therapy has shown to be very effective in the treatment of anxiety. Mindfulness therapy. In addition, there are other very specific behavioral therapies that help with anxiety and panic attacks.
So, for example, if somebody you know is suffering from a panic attack and you really have to curb the situation, I mean, what's the first thing you should do, and what's the first thing you should never do? You know, the do's and don'ts.
That's a very good question, because
hospital.
people sometimes don't know how to help someone. I trained both as a physician and as then specialized in psychiatry. First of all, I think you really want to make sure, you don't want to assume it's panic. If somebody is having chest pain, you want to make sure that they are not having a heart attack, certainly. If somebody has passed out and they may say they're feeling anxious, you want to make sure that they have no history of, say, being a diabetic, they're not getting into a hypoglycemic episode, they don't have a history of TIAs, transient ischemic attacks, they're not really having some kind of a CVA. But if you're pretty comfortable that it's not, and and that it is anxiety and panic, then I think ask the person if they can to go to a quieter place. If they're among people, remove themselves, help them go remove themselves, find a nice quiet room, help them breathe. In more extreme cases, if they can't control their breathing, take a paper bag, hold it, have them breathe into the paper bag, which changes the oxygen carbon dioxide mixture, and that will physically help them calm down. Stay with them, give them a glass of water, or ask them, do you need a few minutes? If they feel comfortable being alone, certainly that's fine. If they don't, then stay with them. Offer them a glass of water, but don't insist on doing anything. Keep in mind, panic disorders, anxiety disorders are not fatal. Somebody will not die from a panic attack. The best thing is, if you let them calm down, the body itself has a natural ability to calm itself down. So I think people, when they have panic attacks, once they get morph into a problem, when people are starting to fuss around them too much, and those symptoms start escalating. So that's what I would suggest for somebody in an acute panic.
Absolutely. I think that you always have to stay calm, because that is also very important to have a calming effect. Great. So now let's jump towards different kind of mental disorders that we have in our society today.
Well, I think I can, my experience has mostly been in the US, but if you want to talk a little bit about your experience in Pakistan, worldwide the disorders are the same. We have, schizophrenia, we have the major mood disorders, which include both depression, bipolar disorders, we have anxiety disorders. I think one of the things that nobody talks about in Pakistan is post-traumatic stress disorder.
That is so true.
We have almost 2 or 3 generations of people who have been subject to wars, who are displaced in this country. We have people who have been victims, who have seen families, friends being hurt by terrorist attacks. These people, unfortunately, I'm not sure if the resources in Pakistan have been there, if people have reached out to them, whether they do struggle.
Voluntary, yes, they have.
Or whether they do have post-traumatic stress or not. So I think there's a whole population that's underreported, undertreated, and I'm not sure how well they're doing. So whatever the worldwide incidence of schizophrenia is, we have the same population in Pakistan. The recognition may not be as good, they may not be in treatment. The content, of course, is going to be different. That's going to be defined by the cultural norms. So a schizophrenic in Pakistan, the content of their delusions or their thought processes will reflect the local culture. Somebody I see in the US who has schizophrenia, their thought content or their delusions or paranoia will reflect the culture that they are in.
Got it. अच्छा डॉक्टर साहब, यहाँ पर ना मसला ये होता है ज़्यादातर that लोग समझते हैं अच्छा कोई मसला है तो या तो उसके ऊपर जिन सवार हो गया है, भूत सवार हो गया है, या फिर उन्होंने हकीम साहब के पास जाना है या किसी आलम से उन्होंने बातचीत करनी है. So how do you think we should be tackling these issues in our society? How do we get rid of them? Like, we have to learn to accept that these things exist.
Well, I'm not an expert in that field. I can speak from my own experience and training. But saying that, I think there is a role for naturopaths. I strongly believe that even as a psychiatrist, as an allopathic trained physician, that there is a role for natural remedies. I sometimes recommend them. Again, I'm not an expert in the field, but Eastern medicine, there has been a lot of history behind naturopaths, hakims. So I don't want to totally rule them out. I don't want to comment on them because I think it's a little beyond my expertise. So maybe in your next episode you can invite a naturopath and maybe they will have something.
I love the way he tried to wriggle out of this situation, and he actually got away with it as well. See, that's a very good psychiatrist right there. But it was a pleasure to have you over on the show. I'm really glad that we talked about this. So for everyone who is watching this right now, what would be your take-home message?
My take-home message would be mental health, psychiatric disorders are very manageable, they are very treatable, whether for yourself, for family members, or friends. So take the time, make the effort. If you see somebody struggling, you could make a difference, and there is help out there. Consider it your responsibility. Now that we've talked about it, hopefully if you have heard some of these symptoms, have more of an awareness.
Fantastic. I think that's a great message. Also, I think that a lot of my sort of followers would love to sort of get in touch with your, your company as well. So do you have a website that they can go on?
Certainly. Yeah. We do have some information available, whatever we put on the website. The website is psychcareludlow.com. That's PSYCH careludlow.com.
Absolutely fantastic. Thank you so much, Dr. Usman Qayyum. A pleasure.
You're welcome. It was a pleasure being here.
Thank you. Alright, ladies and gentlemen, thank you so much for watching. My name is Sophiya. Of course, you were watching the S Stories right here on Sophiya Anjam's official YouTube channel. Aapko pata hai, every Friday 7 p.m. we host this show for you. And jate, yes, you have to subscribe right now. As you can see the ticker also. Sophiya Anjam, we are on Twitter, Instagram, Facebook, Snapchat, you name it, and we're there. Today we were talking about mental health and about disorders also. So go ahead and support those family members, those friends, those colleagues, those people you know who are suffering from those mental disorders. Learn to be empathetic. And last but not the least, pain is real, but hope is also real. God bless everyone. See you next week. Bye-bye.